Hi, my name is Patricia Avalos, and I'm doing a speech on medical ethics. Medical ethics is quite literally a life or death issue. People usually don't spend time contemplating on it until it is too late for everyone. It is right for a doctor to refuse treatment to a patient, even if their life may be threatened based on their personal beliefs. People often think that doctors should just be a tool for a patient with their own moral code and often refuse treatment when what is asked of them and it violates the code. Yet, to what extent is it justified to refuse treatment to a patient? All of these issues fall under the umbrella of medical ethics. These ethical problems boil down to one decision: who has the final say on medical decisions? The medical staff, with their years of expertise, or the patient with their greater understanding of what is good for them? So who decides when life begins? This is probably the most public debate of medical dilemmas. Most everyone has contemplated this issue, including doctors. Is it their prerogative on what effect the answer has on the treatments? Sabrina Rubin Ederle, in her articles, Doctors' Beliefs Hinder Patient Care, explores the impact of the personal, moral code, and religious beliefs of doctors and their effects on the patients. She examined multiple cases in which the beliefs of a certain doctor or hospital had to the effects of a patient's mental and/or physical state. Her claim is evident in the title of the article. The personal beliefs of the doctors are just getting in the way of what is being taught and what is being told to the patients. Ederle is quoted in her article saying, "When you see a doctor, you presume that you're getting all the information you need to make a decision. Unfortunately, now we can't even trust the doctor to tell us what we need to know." Ederle also provides the other side of their argument so we get the full picture. She interviews a doctor from a Christian clinic, and that says, "Doctors are people too. We have to be able to leave the hospital and sleep at night knowing we made the right decisions for the right people." One would be that it is pretty clear when to declare a person dead. And this is not the easiest thing. Coma patients who have been declared a non-person because of lack of brain activity have been well recorded to awake with a full recovery. If people are declared dead after this loss of brain activity, these people will lose their chance to live. While on the other hand, if death is declared after there is no heartbeat, they might fill needed hospital beds and valuable doctor time. Lawrence A. Howard believes that the patient's families should have the full decision and power on their loved ones who are declared dead, or a non-person. He sets out a bullet-pointed list of specific cases in which the medical staff had mistakenly declared a coma patient hopeless, when there is clear signs of life remaining in them. Some of these cases, the patient's lives was lost when there was clear evidence of recovery, Howard explains. Organ harvesting teams must practice with scrupulous ethics and avoid for-profit motivation. Some believe that this is unrealistic and that doctors shouldn't be pressured by families to make certain decisions. Doctors have been trained their entire lives to make good decisions in their careers. Sometimes that means putting emotions aside and making the realistic decision. There will always be controversy over medical ethics and the consequences that go with certain decisions, and very often these controversies lead to the court of law. Yet, as Ederle states, most, if not all, of the laws governing this medical gray area are too ambiguous to be concrete and ultimately useful to either side of the issue. One possibility is to iron out all of the ambiguity from these laws and make them more effective in solving the problems that plague the medical field. This would allow the court cases to be more abrupt and efficient, no matter which side the law chooses to see. This presents many problems, though. Who decides what the law states about medical ethics? If the law is supposed to be all-powerful, then it would be almost impossible to let one or even a few cases decide what should happen to everyone across the nation. Another possible solution would be better train the medical community to resist coming up with their own alternate agendas, as Howard suggests. Although this becomes unrealistic, as medical professionals already spend years and years in school being trained on a myriad of subjects, including medical ethics. This training may also wear off after years of serving questionable patients. A final suggestion is that a kind of watchdog group is created to monitor current issues of medical ethics and doctor-patient relations. They may be able to take the load off of the justice system by having many medical professionals constantly analyzing the medical issues that may arise and passing judgment onto them. The issue with this solution is that there is no feasible way that one group could watch over the whole nation's medical issues. Even if they are able to watch over everyone, who decides who is in the watchdog group? Our nation has been born with a system that has been able to adapt and reform to new issues as they arise. The judicial branch of the government was never originally conceived to deal with problems as complex as medical ethics, but it will adapt to the growing concerns that deal with this gray area. The new laws will be able to bring these issues down to black or white situations, which will be easily dealt with, whether they deal with life or death. Thank you.